Enjoy the programme. Let's have our first question tonight, which is from Navreen Fagura.
With a record 50,000 patients a week experiencing over 12-hour A&E waits, when will the Prime Minister finally admit the NHS is in crisis?
So, Navreen, you're asking this question. What is your experience with the NHS? Why are you asking it?
Well, I'm a junior doctor, so I'm working in the NHS. I've worked on the front line, and you just see the problems. Patients can't move from A&E into beds on the wards. Patients are just there, especially elderly patients who need social care. They just can't be discharged. They're there for days and if not weeks. And you've just got really sick patients in ambulances that just can't move through the system. And just like recently, my own nan spent 48 hours in a trolley in ED before she could move to a ward. So I experienced it through work and through my own family. And it's just in crisis. And I just think there's been like a decade of underfunding and a workforce crisis that has not been addressed. And this is why, I think the NHS is pretty much at breaking point.
So, Alex, Navreen is a junior doctor, is using the word crisis. The Prime Minister conspicuously is not using the word crisis. Yeah. Is he wrong to do so?
Well, I think that the Prime Minister is absolutely clear, and he's said this, that the NHS is under extreme pressure, and he's not balked about that at all.
But why the word crisis is... Many people have asked him to try and get him to say it, and he's not saying. Is that because he doesn't think it is?
No, look, I think he recognises this is immensely serious, and certainly when he did his speech recently at the beginning of the year, he named getting down the waiting list as one of his absolute priorities. And of course, last weekend, as you know, he was there meeting with the NHS. The pressures are absolutely extraordinary. I think we know that. But what he's been absolutely clear about as one of his targets, he wants to get the waiting list down to, they were at 2 years, not least because of the backlog from COVID, get them under 2 years to 18 months maximum by this spring, and then by next spring down to 12 months. And what he said, and I think this is really refreshing, is he said, look, here I stand, this is the target, this is what I want to be judged on, and if I don't, you please do judge me. And I think that's absolutely the right approach. So he's been clear, yes, this is an intense issue, but he's got a plan to deal with it.
Okay. Navreen, you asked the question, does it matter to you whether or not the Prime Minister uses the word crisis or not?
I think it does, because if you acknowledge there's a crisis, then you know there's a problem to fix. But when you're not just skirting around the issue, you don't really do anything properly to change it. And by just saying we're investing loads of money this year, if you look, the own Department of Health funded a report which showed, by the King's Health Fund, which showed there's been a decade of underfunding and not addressing the issues, which is why we're in this problem. It's not just the COVID backlog, it's been going on for years, and we don't have the staff or the beds or the facilities to actually fix this. What Rishi Sunak says just will not happen. We just don't have the staff or the beds. And there's no point saying we've got loads of new people coming in if the current nurses and doctors are leaving. And we have the lowest number of doctors per 1,000 in the population for OECD countries. So there is just a problem that they're just not addressing properly.
Well, certainly demand is colossal, and it's not just because of the pandemic, although the pandemic did have a very significant impact, not least because people weren't being referred, people got sicker because elective care didn't happen, which is why he wants to continue with elective care. But on the specific capacity, since 2010, there are 34,000 more doctors and 44,000 more nurses. Now, I absolutely accept that we need to go further, and he is going further. And indeed, I think since 2019, I think there have been an additional 4,000 doctors, and there are 72,000 nurses and midwives currently being trained. But what we have got to do is to ensure that we don't make, as it were, don't make the mistakes of simply saying, right, we're just going to focus on urgent and emergency care. We've got to get through that elective care, because if we don't, those people will become sicker. And that's what, last thing is that, I know you say it's not all about money, but even at a time like this when finances are stretched, he found an additional £14 billion to ensure that the NHS has got really resources going into the coming years.
Anna, just say, obviously, because you were a former government minister for public health.
Yeah, absolutely.
Are you convinced by that? You're shaking your head.
How the hell can we sort this problem out in an honest and effective way if we can't even admit that there is a crisis, and it's the biggest crisis in the NHS's history? And until we have a government that actually accepts that, we're not going to make progress. Look, there are certain things that this government should be doing absolutely now. The first thing is to sort out the nurses' pay claim, the other pay claims, and it's up to the government to do it, and it can do it, and it should do it. You're a junior doctor. I'm a trustee of a little charity called Doctors in Distress, and we know, as you know, the reality, lots of you know, the reality of what's happening in our NHS. We have people on the front line who go into medicine because they care passionately to help people get better, or if they can't make them better, to ease their pain and discomfort. These people are burnt out, they are at their wits' end, and they are leaving because they are racked with guilt and shame that they can't deliver the service that they want to deliver and we expect. So sort out the staffing. Increase the morale, therefore, of our workforce and let them get on and treat patients. Let's bring back all those EU workers and fill some of the gaps in our staffing levels. And because one in 8 posts is unfilled. It's a crisis. And the third thing which this government must do is make now the changes to social care. 1 in 8 beds is blocked by somebody who can't go into a care home. And Alex, I was in a government that knocked it into the long grass. Other subsequent governments has done it. Your government is now doing it again, and it's not good enough. Okay. If it means I have to pay more tax, I'll pay more tax to give us an NHS which is doing the job we all want it to do.
There are a lot of hands up. The lady there in the yellow dress, I saw that you were nodding along to that.
I'm also a junior doctor, and I live and work in Anna's old constituency. And I work on a dementia specialist ward, and I've had patients who are medically fit, who do not need to be in an acute hospital bed waiting for placements for months now, because there's 165,000 vacancies in social care and you haven't addressed it. Last year, 7,000 doctors approached our regulator looking for permission and their paperwork to go and work abroad. You only train 8,000 medical students a year. Yeah. Retention is in crisis in the NHS. You must address it. You must address it. And my trust declared a critical incident, and it stepped down the critical incident, not because things are getting better, but because it doesn't make any difference us declaring a critical incident, because you refuse to accept that this is a crisis and people are dying because you are not addressing the problems.
Okay, a woman here in front in the pink dress.
So I'm an emergency nurse practitioner. I've only been qualified actually for 4 years.
Oh my goodness, it feels like our audience is full of people. I know it isn't, but I seem to unerringly seem to have found you. Yes.
I've only actually been qualified for 4 years. I've been on the front line prior to the pandemic, during the pandemic, post-pandemic. I'm going to put this bluntly, it's like a war zone. There's beds everywhere, there's patients everywhere, there's elderly people. People who are sitting on chairs for 24 hours. It's not okay no more. It needs to be addressed. It needs to be addressed now. Like in 2019, there was a manifesto pledge that there was going to build 40 new hospitals. That hasn't even been done remotely, even looked into. Where are they finding the staff to even staff those? Because they can't retain the staff they've got because they don't know how to look after them. All we get told is we're not skilled enough, we need to justify a pay rise, and I think we've justified it enough. We're tired and we've had enough.
Yes. OK. I'm going to come around the rest of the panel. I just want to give you one last chance, Alex. Do you want to admit the NHS is in crisis? Well, if the Prime Minister doesn't, do you, hearing this, do you want to?
There is no doubt that the pressures are at historic levels.
And you said that. Do you want to say
the reason why I say that is because, you know, talk is cheap, action is what matters. And
I'm not asking what you're asking. You've made clear already about the money.
Yes or no?
Yes, well, that's what I'm asking you.
It's incredibly intense, and the pressures are
OK, so you don't want to use that word. I think we've got that. You clearly don't want to use that word.
No, but it's the actions that matter.
I know we've heard that. I'm just asking about the word.
There's a crisis. Listen to people. They're
So,
on the front line.
It's clear that the NHS is in crisis, and it's facing the greatest crisis in its history. And those of you working in the NHS see it every day. But what everyone who uses the NHS and needs the NHS every day, they also see that. Because if you look at how long people have to wait, you know, stroke victims, heart attack victims, an hour and a half when every second counts, sometimes more than 3 hours in order for an ambulance to arrive. And, you know, we're in the ludicrous position at the moment where Conservative ministers are talking about introducing minimum standards during strikes. You can't guarantee on a normal day that you will get an ambulance when you need it, and that is terrifying. It is terrifying for everybody that the NHS is not there for us when we need it.
So
and
what does Labour think the answer is?
Absolutely. So
I'm not suggesting it's simple, but what do you think the answer is?
It's far from simple because, you know, the next Labour government will inherit an NHS that has had 13 years of Conservative mismanagement and underinvestment. So it will take time to put it right. It took time
so after 1990.
It took time after 1997, and we fixed it and we transformed the NHS, and we will do it again. And that will come down to workforce. We need more doctors, we need more nurses, we need to change the way that the NHS works. And that's why we've set out the most ambitious plan for a generation around recruiting that next generation of doctors and nurses, so that those colleagues already working in the NHS have got that extra backup, because we are losing people in their droves, because the pressure is just enormous. You know, when I speak to people locally working in the NHS as well, nobody goes into public service or goes to work in the NHS to come home feeling that they've let people down, or that they're burnt out, or that they can't cope. And that's why people leave. And under
to
Labour,
recruit all these extra people, will you expect people to pay more taxes to pay for that?
So we would fund that by ending the non-dom tax status, so people that are the wealthiest in our society.
That's not going to cover it all, though.
It will absolutely. No, it does cover it all. The plan that we set out, a fully funded, fully costed plan to end the non-dom tax status. The current Chancellor, when he was chair of the Health Select Committee, said it was a great idea. I would love it if your government adopted Labour's plan and got on and did it, because people can't wait.
All right, Tim.
I think the best chance you've got of seeing a doctor nowadays on the NHS is to go on Question Time, because
it's only beginning to feel that way.
In the audience. I think the government is reluctant to use the crisis word for two reasons. One, because it doesn't want to panic people, so that people will stop trying to stop using the service if they think that it's completely broken down. So I think there's a rational thinking behind it. The other reason is they want the idea to percolate that there are things beyond the government's control that are responsible for this, notably COVID and lockdown and flu. The problem with that argument is that the service was in a poor shape before COVID and the lockdown. And it was in a poor shape in particular because of a failure to reform certain things, like the way that GPs work, because of a failure to invest in social care, which is why you've got horrible term bed blocking on the NHS, and also because of a failure to invest. Now, it is true, the government will immediately say, but we have recruited more staff, we have spent more money in real terms. That's true. But the thing about health spending is it has to increase year on year well above inflation for it to keep pace with growing need, and particularly with an elderly population and changing technology. So the problem is that the government can say, here's the figure we put in. It's not enough year by year to meet the demands of a rising population. So the solution is either a significant increase in tax, and taxes have already gone up, or some other kind of root and branch reform, which I'm wondering if people are starting to think might be possible. I was very interested that Wes Streeting, the Labour Shadow Health Secretary, has said that they'll use more private beds. Well, what about using more private medicine? I mean, when it comes to, for example, in Australia, higher rate taxpayers are effectively obliged to buy private insurance, and there's been a large increase in people doing that. Now, from all my years of going on Question Time, I know that the two most unpopular things to support are incest and private medicine. But nonetheless, I think we're reaching a point where people can see that this current structure does not meet the needs of an ageing and growing population. And perhaps we need a royal commission. We need some kind of broad, honest discussion about what we can afford, what's not working, and we've got to fix it in the long term. Short-term cash injection, long-term structural reform.
Ash, a few more points from the rest of the audience. The man here in the blue shirt.
I'm currently a junior doctor as well. I'm working as a teaching fellow in one of the hospitals nearby.
Can I just... Everyone put their hands down. How many NHS workers are in this audience? Put your hands up. Right, well, I just seem to have found you all somewhere. But anyway, yes, OK, put your hands back up. Yes, man in the blue shirt.
I think much of the underfunding and the pressures and strain that's currently going on is having quite a large impact as well on the repercussions of undergraduate education. I'm obviously teaching and educating the next generation of medical students, where they are now actually struggling to get the opportunities they require to be trained appropriately. And actually it's making a lot of them put off having to work in the NHS going forward. So I suspect that actually this will have a large impact on vacancies going forward, and much of my students come to me anyway as a result, asking what other opportunities they have to be looking outside of the NHS.
Gosh, even after going through all that training. The man here in the front in the blue sweater. Yes.
Yeah, almost every week on Question Time, the government representative says, we've been hiring all of these people, we're increasing this number, we're increasing that number. But that is completely irrelevant if the people there are leaving. If you're only filling the people that are leaving, it's not improving the situation.
I mean, there are actually, despite how it feels to so many of us, there are actually more doctors and more nurses now than there were, let's say, in 2019, despite the numbers of people leaving.
Yeah, but unfortunately, I've been in and out of hospitals in Birmingham area for the last 2.5 years for various different conditions, and the last time was in August. And I was in Solihull Hospital on a ward with 27 patients, and there were 2 nurses on the night shift, a man and a woman. Both of them got attacked by other patients during the night, and I ended up helping them because they just couldn't cope. And the female nurse in the morning said to me, I don't think I'm coming back tonight. I can't take it anymore. And if people are leaving in droves, you can hire as many as you want. It's not going to fix the problem. What you've got to do is keep the staff we've got.
Ash, we haven't heard from you yet. I mean, the question is, when will the Prime Minister admit the NHS is in crisis?
Well, look, the reason why you don't want to admit that it's a crisis is because it makes your government look bad, and it's that simple. But if you can't be trusted to describe the problem, why should we trust you to fix the problem? It's wholly deceptive.